Dr. Titilola, and yes, I'm on now. And I'm basically here to talk about, sorry, 1 second. My focus is connection between physical health, intimate areas and mental resilience. And I'll just be speaking on that, and I hope that we get perspective from there. To be fair, this is like my first engagement having to speak like this. So I'm a little nervous, but I'll do my best to do that well. So basically, when I got the topic, what I was meant to talk about, right, I was surprised because I didn't exactly think through the fact that you could, like, mental resilience could be connected to your physical health as well as your intimate areas as well, right? And I think that the definition of intimate areas are areas that are covered by clothes, basically, right? But the common misconception that we have is the fact that we believe that because an area is covered by clothes, you should not talk about it, or it should not be, if you have an issue with that area, you should not speak about it at all, which I think that is very wrong. Now, so you asked that what are the intimate areas that we should know or talk about, basically, or the intimate areas that we have as individuals, part of our body parts, basically. So we have the external intimate areas and the internal intimate areas. And so when we say the external intimate areas, right, we're talking about more of the ones you can see from the external areas. So for the women, if you don't mind, I'm going to have to be a little bit specific. So for the women, we have the vulva, right? So it takes cognizance of your vagina, your clitoris, labia minora, majora. For the men, we have the penis, and then they are not the intimate, the internal ones that are the ones that you can see, right? So, and they are more of the reproductive organs, basically. Now, the question is, why are we talking about that with your physical health and mental resilience? I come to understand that in medicine generally, right, if you have anything wrong with your health, your mental resilience is important as to how you cross over to the other side. Now, so if you have the will to know that, and you have, I think mental resilience to me is knowing and coping with the ability to cope with challenges. So if you are certain and you're sure that this phase will pass, or this particular issue I have with my health will pass, it will pass. But if you already think that it will be hard for you to cope with it, it will be a little harder and longer to actually cope with it. And so the question is basically that if you have issues with your intimate areas, generally in terms of physical health, you need a good coping mechanism to understand that you can actually, it can actually get better, basically. You might then go on to ask that what are the examples of intimate issues that you might have, or issues with your intimate areas, basically. So for women and men, they differ. For women, issues with your intimate areas usually would entail the regular urinary tract infection that we all talk about. Moving on to that is, and when you say urinary tract infection, you have symptoms like more frequency in urination, burning sensation, the regular sexually transmitted infection. That's very common. That's what most people think about when you hear issues with intimate areas, to be fair. Other examples include things like endometriosis, PCOS, things that have to do with your reproductive organ, basically. For men, the common one is the erectile dysfunction as well. Those are and the list goes on from there. Moving on from that, basically, you might now go on to say, how can I tie this to mental resilience, right? I think that because of the misconception that when you have issues with your intimate area, it should not be spoken about. Because even when I've had patients come to meet me, I would have to talk about it. I would have to ask questions. I'll have to make them get comfortable with me first so that they can open up and talk about it, because they come with a symptom that is vague. And so I have to keep asking questions to get to the point. And so even with doctors, you're not comfortably sharing this. So it gives you this feeling of, number one, you feel more self-conscious. That's the first thing. Number two, you don't feel confident in yourself. And the other one is that you feel that you are less for those reasons. Give, for instance, a man that has an episode of erectile dysfunction, because there are times where you have it in your lifetime, that the ones that are constant, because there are different types of erectile dysfunction, of course. If he were to come to complain to the doctor, he won't go straight to the point. If you have years of practice with when you can tell this is what he's talking about and this is where he's driving at, right? And I think that most people don't even seek the need to seek care because they think it's something that is unheard of. So basically that can affect you in that area mentally, right? So the question that you then go on to ask me is, so in this type of situations, how can we tie all this together? I would say it doesn't just have to be with the areas that are not seen or that everybody can see. I think that a physical health and well-being is ties to all the parts of your body, right? And I genuinely think that when you have issues with your intimate area, it can lead to some level of mental reduction in your mental issue, in the sense of you might have to fight, how to explain this in words? You might have to, it can affect you mentally in terms of stress, anxiety, and legs. Now, I meant to also talk about prevention tips, like how to prevent, and tips on how to not have intimate issues with your intimate areas, basically. And before I go on to that, I would say if you do have issues with your intimate areas, the things I talked about before, the first thing you should do is speak to a friend that you can trust, right? Do not think you have a problem. The second thing that I advise you to do is seek care, right? And I think that you also have the right to seek care from the doctor you're comfortable with. I don't think that because you see a doctor, you have to walk through it with them. The doctor you have to see, are you comfortable seeking care from the doctor? If you are, then go on asking questions and then you seek the care you need. I also think that it's important to understand your intimate areas and also know when you have an issue with them. And once you have an issue with them, seek care immediately. Now, what are the preventive tips on how to ensure that you don't have issues with your intimate areas? And for women and men, it varies, to be fair. For women, but generally, the first thing I'll say is proper hydration can actually help. Hygiene is also very important. The type of underwears we wear, the way we clean the intimate areas is also very important. Safe sex practices is also very important. Use of barrier contraceptives as condom, regular testing for sexually transmitted infections is also very important. In addition to that, what can I also say? It's good to also have people that you can talk about these things with, or doctor that can see as well. So regular visits to your reproductive health doctors, urologists and gynecologists are very important. I think that is where I would stop in terms of prevention. So I would say this, that basically, in conclusion or in summary, I would say that if your physical health is not up to par, specifically in your intimate areas, I think that it is important to understand that it's not exactly your fault that has happened, and you can get adequate care medically and then come off and be better, right? So people that have chronic conditions like PCOS, PCOS, erectile dysfunction, and the likes, it's important to seek the right care and also have the understanding that you could cope with it and do not allow this to affect your self-confidence, how you see yourself, and hopefully you come off and be better generally in life. I think that I've come to the conclusion of my talk, and I hope that we learned something today.